So I'm Peter Saxton from the University of Auckland School of Population Health, and I'm the Research Director of the Gay Men Sexual Health Research Group. So today we talked about the findings from a study looking at pre-exposure prophylaxis, or PrEP, and we wanted to learn about the experiences of being on PrEP, so looking at taking the pills, experiences of side effects, STI incidents, and taking breaks. So the purpose of the study today was to look at the experience of taking PrEP in the real world, and we do that because we want to improve the clinical practice, the care of people on PrEP, and also guide prevention programs. So we looked at taking pills, and in fact most people take PrEP either in the morning or in the evening. Looking at the last week, most people took the pill every day, so that's 7 pills over 7 days, but a quarter didn't, but most of those people only missed 1 pill, and that's perfectly fine in terms of PrEP preventing HIV. We also looked at the experience of side effects. About a third of people experienced a side effect in the first 3 months, but that waned over time, and in fact it was really only a third of participants overall over 12 months who ever experienced side effects, and they weren't that severe either, so that was important to hear. That obviously leads us into thinking about treatment breaks, and so not everyone wants to be on PrEP all the time. We found that about 30% of all our participants over 12 months would take a break at least once over 12 months. Now that might be as short as 1 week or a few days, but for about 60% of people it was for longer than a week, and some people stopped altogether. And then finally we looked at STIs. So obviously PrEP is a program, so people go every 3 months to the sexual health clinic to get a range of tests to make sure that PrEP's working for them, that it's not damaging their health, but also for screening against STIs. We found that about 50% of our sample had a rectal STI, that's either syphilis, chlamydia or gonorrhea over 12 months, and about 70% had actually any STI, whether it's rectal or not. Now that's clearly quite high, but not unexpected because this was quite a high risk cohort. And it really just showed that this is the group who really do need to be on PrEP, because in the absence of taking PrEP, that high burden of rectal STI would mean that they're at high risk of acquiring HIV if PrEP wasn't available. So that's really important and reassuring, but it also means that as well as thinking about being on PrEP, we need to think about the process of coming off PrEP, because with such a high rectal STI incidence, obviously that puts people at high risk of HIV if they stop PrEP. I think obviously PrEP is for people who are HIV negative, but many HIV negative people are obviously sexual partners of people living with HIV, so that's one part of the equation of thinking about living with HIV today, but also the new prevention paradigm that we find ourselves in. I think one of the interesting things about our study is we asked people about their attitudes to being on PrEP. So this is obviously HIV negative people who are taking HIV treatments, and in fact most of them over the study period were more likely to disclose that they were on PrEP to their friends, to put it on their dating profile, and were less concerned about whether people knew that they were on PrEP. I think that says some really important things about HIV stigma generally, because obviously being on PrEP raises conversations about sex, about HIV, and about taking medications. And I think it's really important that for people without HIV, it's part of the normalising of being on HIV treatments and destigmatising HIV. I think the other thing that our study tells us is that it's important to keep an eye on STIs other than HIV. So of course, treatments promise a completely new world in terms of our health and well-being, but also in terms of limiting transmission. But we also know that we should think of sexual health holistically. So for people living with HIV, that means not forgetting about other STIs, in particular gonorrhea and syphilis and LGV, which we're seeing rising in the general community anyway. So on top of routine HIV care, really important to keep on top of STI screening, in particular at all the sites that are relevant. So we're thinking about mouth, bum and penis as well for gay and bisexual men. And to, like we're seeing with HIV, continue this journey of destigmatising STIs as well. So encouraging our general practices to ask us about our sexual health, encouraging amongst our peer groups conversations about sexual health, and I think this is part of the whole package of destigmatising not just HIV but other STIs too.